Hi, I'm Dr. Melvin Hector. I'm an associate professor of geriatrics at the University of Arizona, and I also work with Team Health here in Tucson. I wanted to talk a little bit about assisted living facilities, both in the United States and in Tucson, and why people make the choices when they decide whether they want or don't want to go into one. Assisted living facilities have flourished in the last 2 decades in the United States. Before that, there weren't so many. Now there are almost 30,000 assisted living facilities in the United States with almost 1 million residents who live in them. If you take that down to Arizona, there are about 1,400 assisted living facilities, of which about 28,000 people live. They have made the decision that assisted living is something that is right for them, but it isn't always an easy decision. It says in the literature that it's easier to have the sex talk with your teenagers than it is to have a talk about placement in an alternate setting with an elder person, especially one who doesn't know whether it's something they want to do or not. The advantages of being in an assisted living are, for many people, a lot more socialization, a lot more opportunity to be around their peers, a lot more opportunity to be able to do things, opportunity to have supervision if you need it, and many do, perhaps not 24 hours a day, but several hours a day. They might need help with very simple things like making meals or reminders to take their medicine or to help with bathing only a few times a week. Whatever that is, there's staff available 24 hours a day to be there to help assist you. And most facilities have a menu where if you're totally independent and need very little help, you don't get it until you do. If you need more help, then they will supply the amount of help that's needed. Assisted living facilities have been, for many people, a welcome alternative to having to be in a skilled nursing facility, a nursing home, where the care and the level of care is at a much higher level. And at assisted living, the level of care that is required to help that person looks more home-like than it does look like a hospital, for instance. There are still pharmacy services available. There are still activities to do. There is still help with things that you need to assist with every day, whether it's planning meals or care with medications, as we said, or any other things. There are people around to help you. There are people around to socialize with. The pandemic has made this particularly a difficult decision because of the disruption that it's made to our lives and our families and the risk that's incurred with COVID infections and the lack of information that is processed in a way that's useful for us. Certainly, any of the facilities that I work in have already taken coronavirus into account. If you are considering going into any sort of group setting, their requirement is going to be that you have testing to prove that you don't actively have coronavirus. And then when you go into that setting for the first 14 days there, you can anticipate being quarantined and being pretty well off to yourself so that you cannot infect others if you happen to be an asymptomatic carrier, or you will not be infected by others by being exposed to them. After the initial 14 days, then things liberalize a lot. And many times in adult care homes, there are facilities that have made arrangements so that your family can come visit, your friends can come visit with the appropriate precautions. And before you go into or consider going into any assisted living, talk with them about their precautions, talk to them about their personal protective equipment, talk to them about what accommodations they've made for this virus and how seriously they're taking it, because they absolutely need to, and you know that. The other thing that I would consider, because only about 50% of people who are eligible in the United States can afford to be in an assisted living facility, you need to look and ask and understand If it comes to a point where your finances will not allow you to continue to pay for a facility, are you in a facility that accepts either Arizona's version of Medicaid, all tax or access, or if you live in another state, their version of Medicaid as payment for your being there? It would be a shame to go into an assisted living facility knowing that before very many months go by, you will need that assistance, and finding out that the facility that you have entered and have become very fond of, become acquainted with the people who help you and the people that live there, only to find that your funding runs out and you have to change to another facility. So these are among the things you might want to look at. It is hard to give up independence, but it is wonderful when you need it to have help. They are there to help you. They will answer any questions when you call. You can accommodate talking with any of the several assisted living facilities here in Tucson that you want to, either online or by telephone. They are relatively easily accessed. Good luck with this. The decision will get easier as the pandemic is over, but that's going to be a while yet. Take care of yourselves and be safe. Thank you. Bye-bye.